I want to thank SAGES for the opportunity to present. It's my pleasure to present this topic regarding SAGES leadership supporting community surgeons. My name is Ross Goldberg, member of the Board of Governors and chair of the Advocacy and Health Policy Committee for SAGES. So when I was asked to give this overview, thinking about it, it really, while the title is SAGES leadership supports community surgeons, it really should be SAGES is for community surgeons. I think a lot of times people are unsure what their role is and how they fit into an organization like SAGES. And SAGES really does have a lot out there for the community surgeon. And I'm going to go through just a quick overview today of what's available and what we have to offer. Disclosures, I have one disclosure, has no relevance to this talk. So let's talk from the very beginning about what is SAGES' role. So if you look at the mission of SAGES, is to innovate, educate, and collaborate to improve patient care. Pretty straightforward. Every surgeon can get behind that. The values include things like inclusivity, innovation, service, excellence, global community. And of course, fun is always one of those that should be within all of our ideas and all of our values, and is an unofficial one for SAGES. But it's a community. We are a group coming together looking to advance surgical care, and we really take surgeons from all walks of life and are really here for all surgeons out there. When it comes to SAGES and the community surgeons, you'd be surprised that a large percentage of our membership identify themselves as community surgeons. About 3/4 of the membership almost, a couple of years ago during a membership survey, identified themselves as being a community practice. So you could almost say that SAGES is more about community surgeons than anything else because the majority of people identify themselves as that. So there really is a larger group than realized within the organization, and there's a lot of avenues and opportunities for the community surgeons within the organization. We have resources all over the place, really, for everyone, but especially for community practice. If you can't get away, per se, because you are a solo practice and have to take care of your patients, we still have opportunities for you where you don't have to be face-to-face to get them done. That's the benefit of this organization. We're really forward-thinking, technologically driven as well, and taking advantage of what's out there to provide resources. So if you want to look at what SAGES offers, to break it down to kind of 4 major categories: the educational opportunities, the networking, the advocacy piece, and the leadership development and leadership positions of that. All of that is available to any member who wishes to get involved here at SAGES. So let's start with the educational opportunities. And I'm going to break it down into online and in person. The online stuff, again, the things you can do from anywhere, which is really useful for in a place where you can't get away for a long meeting, you can't travel, especially nowadays with the pandemic, you're really not going anywhere. So there are opportunities to still learn and evolve without having to do face-to-face, which we still offer in times when we can be face-to-face. So looking at online, you've got over 30 hours of Category 1 CME credit. We've got these webinars, these great webinars that have a lot of online learning and interacting. Don't forget, we have access to our journal, Surgical Endoscopy. You get that free when you're a member of SAGES. You go through the SAGES portal, you're on there, and you have access to all the latest issues and latest data being published. There's video workshop and courses. We have our SAGES TV channel. You can find stuff online where we've categorized kind of different presentations and different ways of doing procedures, and we have that available as kind of an educational session. There's the virtual hernia clinic. Again, an interactive way to kind of expand and improve upon your knowledge regarding hernias, a pretty big field within surgery. The master's program is one of those ideas. Again, becoming a master in something, there's a pathway where you can, again, through evaluation, collaboration, and showing what you're capable of doing, obtain that level starting from beginning to end about you're a master in a certain technique: foregut, hepatobiliary, hernia, endoscopy, bariatrics. These are all categories that are available if you're so interested in pursuing them. The clinical guidelines. Again, SAGES puts out guidelines regarding a variety of issues like take hiatal hernias and reflux disease and how to manage that and what does the evidence show. And it evolves and changes over time. So this is all online for you to look at to see what's available. Then finally, the in-person stuff. Yes, the meetings are fantastic, and we can't wait to be in face-to-face again. Within those meetings, there are hands-on courses where you get to really kind of get your hands dirty and not only get taught by experts, but practice as well on, pig carcasses or at least pig stomachs and things like that, doing endoscopy and other hand-on techniques, learning what's available and what you can do. And that's something SAGES offers to all of its members. When it comes to networking, there's an online membership directory. So you're immediately in contact all the different members of SAGES. You have access to their information, how to get a hold of them. We're one big giant community. And we act like that. If you come to the meetings, if you've ever seen one of our meetings, we really are one big fun community that supports and helps one another. If you're a SAGES member and need help, another SAGES member will help you out. You can find them online. It's really not hard to do as a member. We've got a variety of committees and task forces to participate in. That falls also under the leadership development side of things. But on these task forces and committees is where you start forming some of these connections, where you have these connections you didn't have before, friends from across the country, across the world, with whom you can connect with outside the face-to-face meetings and really build relationships with, both professionally and personally, to help strengthen your networking within the House of Surgery, and then kind of just as a professional career, building that forward. And then there's the Facebook groups, which has been an innovation over time. Again, area of collaboration, sharing videos, sharing discussions, open forums where you can connect in real time with people around the planet on a variety of issues. And again, if you're looking for someone in a particular area or dealing with a particular issue, you have that opportunity. If you live in New York and you've got a family member or friend in Sacramento, you can go on there, go to does anyone do this type of surgery in Sacramento, and you'd be amazed the connections you can get just from asking that one question in this environment. So there really is a lot of opportunities to network and connect in ways you couldn't normally. Advocacy. As chair of advocacy and health policy, I'm obviously biased towards this. We are in a variety of different roles when it comes to advocating on behalf of our profession and our patients. One area is the CPT RUC process, the patient billing and coding. That's not a small thing. We have representatives to both the CPT editorial panel and the RUC, which through the AMA. Again, setting value to our operations and our clinic visits, and what is the value and what we can build for that. And again, we help provide input as far as what codes need to be how much value should they be given, what should be lumped together, what should be treated separately. We have a role in that process. We're involved with the American Medical Association. We have a delegation that goes. The AMA is still seen as the House of Medicine. We want to make sure our voice is heard within that house and help direct the policy that's coming out of the AMA. So we have a strong presence within that organization at their House of Delegates setting policy. We have a variety of work groups, not just within our committee, but within others in the organization as well. We're looking on patient advocacy and engagement, looking at the bariatric committee regarding coding. There's a variety of different ways we're engaging to make sure that our issues are brought to the forefront. We're also part of a large group called the Surgical Care Coalition, which is being led by the American College of Surgeons, has a bunch of other surgical organizations in there, dealing with issues like the Medicare reimbursement issues that are coming up in 2021. Realizing that those kind of cuts will hurt, especially people in private practice, the community surgeons. We want to make sure that they're able to keep their doors open. So we are advocating very hard in that realm, serving as a member of this coalition, part of the PR campaign, part of the lobbying effort to advocate on behalf of our members. Leadership. There's always opportunity if you want to expand upon your leadership through courses available or by just getting involved. We have hundreds of committee members. There are many, many committees available at SAGES. So there are things that you're interested in, you can find. You apply, and we put you on committees and we start engaging you. And if you show some interest, there's opportunities for growth, for more leadership opportunities. It really is a way for you to kind of grow and evolve within the organization. We even have a community practice committee focused on the issues for the community practice surgeon. Dr. Caitlin Halbert is our chair with our co-chairs of Nicole Fearing and Kevin Wasco. They together form your trio, kind of your point people within that committee on a way of reaching out to all of our community practice surgeons to make sure they are well represented and that their voices are heard within the organization. So really, I just blew through a whole lot. But what it really shows is that we have lots of opportunity available for anyone who's in community practice and how they want to get involved or take advantage of the resources available at SAGES. This doesn't require you have to be face-to-face. We'd like that. It'd be nice to have that human contact, but if you can't, and you can't make it, we still have opportunities for you. You are not limited by not being able to come to the meeting. Technology has evolved to allow you to do that. So here's your opportunity for involvement without having to leave your house. It's a great way to get involved. And then we're looking at programming specific for the community surgeon. Every one of those issues I listed about does have to make sure that we're paying attention to the needs of our community practice doctors. It's coming into the meeting. Obviously, there's a whole session, as you're seeing, involved with it. So we are evolving that practice and need input from community practice doctors to do that. So this is where our surgeons, our members in community practice really have a big benefit here. So I really want to thank you for the time. It's brief, but I really want to give you a quick overview of what we have to offer our community practice surgeons. I thank you for being members. If you're not, please join. If your partners aren't, please have them join. We really can make a bigger difference the more of us that are involved. So I encourage continued participation. Know that leadership is always available. You can reach out and contact them and discuss things with them at any time. And as a board member, I'm always happy to help as well. I thank you very much for your time. Have a great day.